us down, we would like to listen to her remarks. I hope, Honorable Minister, you know Professor Nancy. She has worked with us for some time.
Greetings all. Before I begin, I would like to recognize the following persons and thank them for their participation. Everyone in attendance for their dedication to sickle cell disease and continuing these efforts despite the global challenges faced by the COVID-19 pandemic. My name is Nancy Berliner. I'm the Chief of the Division of Hematology at Brigham Women's Hospital and Professor of Prevention of Disorders Affecting the Blood, with over 18,000 members across the globe. From African countries by screening 10,000 babies per year and enrolling sickle cell disease positive babies in clinical care up to the age of 5 years. ASH is providing financial support in the screening of newborns and has created a global network of experts to support newborn screening and clinical care for infants identified with sickle cell disease. We look forward to the great work from the Uganda program led by Dr. Charles Kiaga, the Uganda National Coordinator of Consa. Sickle cell disease presents a considerable health problem throughout Africa and the world, and ASH is interested in doing our part to support stakeholders in demonstrating the value of newborn screening to save lives. Through our efforts and partnerships with the Ministry of Health, civil society organizations, and industry partners, we hope to see the expansion of sickle cell to sickle cell disease. We remain committed to supporting these efforts over the next several years. Thank you again for inviting me to participate in this event, and I look forward to hearing from fellow speakers.
Thank you very much, Professor Nancy, and we are grateful for your support.
Indeed, Uganda is the second country in Africa for us to sign the MOU. We started in Ghana, and we launched a similar partnership agreement 2 years ago, which has been quite successful. And today, we are witnessing the inauguration of this agreement in Uganda. It gives us a lot of pleasure and fulfillment to see that we have come this far after many days, and many weeks, and many months, and many years of deliberations and consultation with the Ministry of Health in Uganda. Honorable Minister, Novartis has identified sickle cell disease as a big neglected disease entity.
That you're going to be able to deliver this message on this day today when we launch the newborn screening and improved sickle care in Mira Regional Referral Hospital. So my role is really to appreciate first the organizers who have been able to get this as one of the awareness campaigns. I want to appreciate you as a Honorable Minister for the role you have played to champion this crusade, and we are seeing the fruits which are coming. I want to appreciate Lira Hospital for hosting us, and we've been very comfortable. Thank you very much for hosting us. The teams from the Ministry of Health, Charles from the Central Public Health Lab and your team. We miss the Commissioner, National Laboratory and Diagnostic Services, but she sends her greetings. All our partners, the sickle cell clients, the leadership, there are just some two statements which I want to mention. And I want to mention that sickle cell is one of the non-communicable diseases. And as has been mentioned, it contributes between 15 to 16 of the infant mortality, mortality. So as a country, if we have about 43 deaths per 1,000 live births, it means that sickle cell is responsible for 7 deaths on those cases. So it means that if we're able to improve care for sickle cell, then it means that we shall be able to avert those deaths, and it means that we eventually be able to improve on reduce our infant mortality rate in the country. Honorable Minister, listening, I think we have as a ministry, we have 2 areas which we are going to work on. One was in the area of the pediatric dosing for the hydroxyurea. The second area is on the area of monitoring, on the laboratory, monitoring for the fetal hemoglobin, because ideally this should be done before you start the treatment and after the treatment, and that's when you'll be able to see improvement. So on behalf of the ministry, I would want that I will take this so that we will be able to follow, so that we can be able to complete those missing dots, so that we can be able to join all of them. Honorable Minister, my last request, since many of us have spoken in English, that when it's your time to speak, you really speak in Lebilango so that the message is really heard and is clear. And I think that will be so that we achieve the purpose why we are here, that the people, the right people receive the message.
It's a great pleasure for me. That's the town clerk of the city clerk. My name is David Chasanku. Recently I earned another one called Okero. So I'm David Chasanku Okero. And I like that name very much. My job is not to talk today, but I want to take this opportunity. When I was going through, Honorable Minister, this flyer we've been given, I was a bit captivated by one paragraph here, National Sickle Cell Survey, which says 13.3% of the total population of almost 45 million are sickle cell straits, which translates to 5.8 million people. I realize this is quite very, very important that we are here today. These are many people, indeed. And I want to thank all the partners, the Minister of Health, for this drive and launch today in our city. Lira City is a good city. You are all come to this city. I hope you can stay for over the night to enjoy the city, which offers quite a number. But for our warriors, we are with you. As a town clerk, today I'm privileged to meet you today. And I'm privileged to be here to launch, when the minister is launching, to know that our warriors are there. And please, we are ready to support in any way to make sure that you live longer and you live and enjoy like one of the current speakers.
I would like to welcome you, Honourable Minister, to this region and specifically to Lira City on the ground of Lira Regional Hospital, where you have chosen today to come and launch the screening and treatment of sickle cell. You are most welcome and you are with your entourage. Madam, Lira City is peaceful, and the people of Lira City sincerely love you. If they knew you would be here today, I don't know, even the whole of this hospital would not accommodate them, but we chose not to tell them that you would be here today because of COVID-19. So they will quarrel with us, the leaders, for not calling them, but we shall handle. Madam, when you see sickle cell, this region is said to be one of the regions that has the biggest population or number of those who get this disease. And choosing Lira here specifically for handling treatment and screening of this disease, I think is the best choice the ministry has done. And I'd like to thank the Ministry of Health for the different services that Lira so far is receiving, which is helping the entire region. We can now have people coming from outside Lango region for treatment here in this center. And that means your ministry is doing something, and the people are proud of it. The government of Uganda has tried its best to make the population understand the services of the government, especially this ministry which you head, which is very pivotal for the production of the economy of this nation, because you cannot have sick people and then you expect to improve on the economy of the nation. But if the people are healthy, then you are sure that there will be development in the nation. And the Minister of Health is doing whatever it takes to see that the people of Uganda remain healthy. And I think this comes along with a good leadership under that ministry and hard-working technical team within the same ministry. On behalf of the government of Uganda, I thank and congratulate you and the team from the Ministry of Health streaming down here for the tireless effort to ensure that our country is a healthy country. We still have, however, some challenges. Recently, last week, you invited us to Kampala to try to chart a way how we can weaken the COVID-19 pandemic that is still trying to prove itself negatively relevant in Uganda. And when we sat down there, Madam Minister, you were able to show us the statistics that our region was one of the trailing regions as far as vaccination against COVID-19 is concerned. And I think that was not very good for us as a region, because people are still dying and people are still getting sick of COVID-19. We could be fighting sickle cells, but COVID-19 is still picking people one by one from amidst us. So I would also wish to take this opportunity to re-echo to our health team and the local leadership in this region, and also specifically to our city here. We need to up our game in mobilizing people and also giving them vaccines. Because if we do not do that, and at the end of the day, our people perish because of COVID-19, we shall also be partly responsible for that. So I call upon a concerted effort in mobilizing and ensuring that our people are vaccinated against COVID-19. Madam, I should also take this opportunity to inform you that we are undertaking indoor residual spraying for malaria prevention within the city. In the past 1 week, the upsurge for malaria prevalence was about 18.6. We need to give support to the ministry, to the government, to the minister, and every other stakeholder so that we achieve our aim of being one of the best institutions in the cities, in the recently upgraded city.
City Commissioner and the entire district leadership, the town clerk of the city, the representative of the Director General, the Director, Lira Regional Referral Hospital, and all your senior top managers, the staff of Lira Regional Referral Hospital, and the warriors. It gives me great excitement to see that we are making strong strides in the fight against sickle cell disease in Uganda. In 2014, when the survey was started, there was very little going on in this country in relation to sickle cell. I had worked in this hospital, and with many staff here, some of them still here, like Senior Nursing Officer Sarah. Sarah is somewhere. Sarah is right there. We have treated many patients. We used to collect the pneumococcal vaccine from Kampala for them so they could get vaccinated, and we take care of them. It was a commitment that if we got any opportunity, we would focus on sickle cell disease. And so in 2015, the National Sickle Cell Survey was done, and the prevalence of the trait was found to be 13.3% of the entire population. That is the trait. Some people call it the carrier capacity. And then that of the disease, that is those who are suffering from sickle cell, were at 0.73%, but the distribution across the country was not uniform. The Mid-North and East Central regions were found to be the most burdened, having over 20% of the trait and 1% of the disease. If you look at 1% of the population, the city clerk already worked the mathematics. If we have 45 million people, that would put those who are suffering at about 45,000 people. 49 districts, majorly from the high burden region, were found to carry 47% of the entire national burden. That was a point for us to begin our planning. And what have we done so far? We have had stakeholder engagement and sensitization, mass community awareness campaigns, and targeted newborn screening in many of the regions that are affected and in all the 49 districts. However, the newborn screening which was being done was not accompanied with clinical care in most of the cases, including here in Lira Regional Referral, where we have been taking dry blood spot to Kampala for screening for the sickle cell disease. It was therefore difficult to assess its impact on survival of children identified with sickle cell disease. The Consortium for Newborn Screening in Africa, this project that is collaborating with us, which combines newborn screening and early intervention using standard of care arrangement that includes routine immunization, folic acid administration, antibacterial prophylaxis, anti-malaria prevention, etc., is a good project because now we can follow up the children. So we are running the project currently in 2 hospitals. These 2 hospitals are situated in cities, Lira City and Jinja City. And within the regional referral hospitals, because the regional referral hospitals have pediatricians, and you heard from the pediatrician himself when he came here and he spoke an hour ago. The project will be run for 5 years. However, we also don't like projects. We are trying as much as possible within this year to roll this over to a full government program for sicklers in the country. And as I will be explaining later, government will be procuring the medicines. The aim is to show the impact of early identification and early intervention on survival of sickle cell positive children. The targeted newborn screening that we have been carrying out was in partnership with Cincinnati Children's Hospital, and in particular with support from Professor Russell and team. Professor Russell has been a good friend, a good collaborator. He supported us to run the survey. He has supported us to set up the laboratory in the Central Public Health Laboratory, and he continues to carry out research. Even the research we carried out on hydroxyurea, he supported. And I want to say a big thank you to Professor Russell. The current targeted newborn screening will also be supported by Peking Elma, and you just heard a statement from them. I thank all the new partners, the American Society of Hematology, Peking Elma, and Novartis for coming on board to run this journey with us as we move ahead with offering services to our population with sickle cell anemia. Lira Regional Referral Hospital will be offering hydroxyurea to patients. Hydroxyurea is already with the national medical stores, and as you can see, we have a box marked Government of Uganda, not for sale. here with us, with support from Novartis Pharmaceutical Company, which is a leading manufacturer of sickle cell hydroxyurea. Novartis will also provide hydroxyurea for all other patients countrywide at a very highly subsidized price, so that people who cannot access it through the hospitals will be able to procure it. The challenge we have right now is that the capsules come in 500 milligrams. Now the pediatrician will tell you that this medicine is given per kilogram body weight. It means we take your weight and multiply it. I think it's about 3.2 milligrams per kilogram body weight, and it is given to you. So it is difficult to give our children right now who cannot swallow the capsules. However, I want to allay your anxiety. There is hope. The same company will be manufacturing the formulations for the younger children so that it is made available for all of us. And we do hope that in the near future, it will be here with us in Uganda. Currently in the country, we only have the 500 milligram capsules. As you heard from the previous speakers, we are not only carrying out newborn screening and opening centers of excellence in Lira and Jinja City. However, we plan to scale up to other regional referral hospitals so that all the areas where the burden is heavy will be able to provide this much needed treatment for all our population of Uganda who need it. With these partnerships, I have no doubt that together we will achieve our collective goal of easing the pain and suffering and improve the quality of life for people with sickle cell disease in Uganda. Our collective goal is to look at a future where our children will not miss school, where they will not be in pain, where they can have equal opportunity for employment, where families can flourish and continue to be the bedrock of our society. And I know for sure that this is possible. There are many people among us here, parents, whom we used to support, and I saw a few.
Today is a landmark in our fight against sickle cell disease. It's a journey we started in 2014 when we undertook to do a nationwide survey. And a lot has happened since then, for which we need to congratulate ourselves. That has culminated to what we see today. I do want to thank all the people that have worked with us this journey. Of course, with the inspiration of the Honorable Minister, who was then the Director General of Health Services. We undertook this survey with the Cincinnati Children's Hospital under the leadership of Professor Russell, who supported us with capacity, laboratory capacity for us to undertake this study. And having seen the burden of sickle cell, which was overwhelmingly high, especially in particular regions, that is the Mid-North, which is Lana-Acholi region, and then the Eastern, which is Busoga, Bukishu, and Teso. These are hotbeds for this problem. And it's no surprise that we are having this event here today, because this is a hotbed of the burden of sickle cell disease across the country. And we want to thank everybody who has put in contribution towards the efforts that we have undertaken. We have undertaken massive efforts around massive awareness campaigns to get all the stakeholders rallied up and know what the burden of sickle cell is. This culminated into a statement. The minister, the Honorable Minister, seated with us here, made a statement on the floor of Parliament and highlighted the burden of sickle cell that was unveiled by the survey to the entire parliamentarians. And we had a training of parliamentarians about what sickle cell is. We have met the religious leaders. We have talked to cultural leaders. One of the highlights of our great efforts of sensitization came through a partnership that we had with Buganda Kingdom, where for 3 years the Kabaka's birthday theme was sickle cell, and we had a very big momentum built around that. So ever since then, we've been doing quite a lot. Of course, resources being limiting, but the energy and the enthusiasm and the passion to get things done has kept us working so hard. Has kept us, sorry, if you're not hearing me very well, has kept us going. And it is what has pulled in additional stakeholders that have come in to support us. Today we are celebrating partnership because we cannot, as government, we cannot do this alone. It's a big burden, but there are many well-wishers out there who, if we articulate our problems, are willing to stand with us. So I want to thank the partners. Most of them are online. The American Society of Hematology, through the Consa project. Consa stands for Consortium of Newborn Screening in Africa. So it is a consortium of a number of countries, and amongst which Uganda is part. 7 countries supported by the American Society of Hematology to carry out newborn screening and follow up these babies that are identified through a period of 5 years, and within which the information that will be generated will inform national programs around the impact of newborn screening. Then we have Novartis. Novartis is another partner, one of the leading pharmaceutical companies in the US, and the leading pharmaceutical in manufacturing hydroxyurea, which is a disease-transforming therapy for sickle cell disease. So initiatives, the newborn screening by the American Society of Hematology, and the improved sickle cell care codenamed Center of Excellence through the Novartis support. So from today, moving forward, a lot of energy is going to be put in this area. And we call upon the hospital administration within Lira Regional Referral Hospital and the health workers working the different stations where these babies go, where these patients interact with the health system, to be vigilant and to do all we can to help out and identify these babies, get them into care. And with all the partnerships that are coming on board, we are having another partner, Pakun Elma. Pakun Elma is one of the leading manufacturers of technology for sickle cell disease. And the technology we are using at CPHL is by them. They are also part of our network of stakeholders who have supported even this event we are having today. So we want to thank them, and with this energy we generate out of here and with their support, we will be going to different regional referral hospitals to launch similar efforts. The next one will be Jinja, but then we will be moving until before the end of this year we must have set up the 6 regional referral hospitals. And then later in the coming years, we are going to scale up to see that we have about 20 centers of best practice of care for sickle cell disease. This has come a long way. When we started, we were doing newborn screening, but it was not accompanied by care. It was not accompanied by follow-up of these patients. But this is going to be afforded through these partnerships that are coming on board. So together today we are celebrating a milestone, and with all this support and with all these gestures of goodwill, we have every reason as Ugandans, as health workers, to do our best in the very best interest of helping the patients. Because sickle cell is affecting many patients. Most of them had actually none of them had a choice. They are diseases you get out of your own decisions you make. But for child who acquire sickle cell, they are basically have no part in this at all. They are vulnerable, they really desperately need help. And I call upon all of you together that we do all we can to see that no sickle cell baby after today will go unidentified, and to ensure that no sickle cell patient will go to the clinic and not to receive care. And I know the Honorable Minister will add to this, but all the support that is needed to ensure that the clinic is able to offer best practice of care for sickle cell disease should be offered. And if you have any challenges, keep us in the loop, and we will do everything within our power, within our capacity, to ensure you are supported and you are given all you need to take care.
So we must ensure that we are healthy, the voters are healthy, the young children who are aspiring to become ministers for health are healthy also. And that is my prayer. I am also hoping that Novartis will come in on time and give us a huge donation to boost our endeavors as a partner, so that we can bring on board many more children who can be given these medicines. We also have to take note that it is not only about hydroxyurea. Our children need other life-saving support. We have talked about folic acid, anti-malarial drugs, antibacterial drugs, and those can be given at the clinic as well. I heard from my daughter, who spoke here on behalf of those with sickle cell disease. She's now 32 years. I was very happy to hear her talk. But she mentioned something, that the clinic is mixed up. I want to give you hope. We have our outpatients under construction, and the teams constructing came back. They will finish, and you will have a special clinic where nobody will bother you, where you can walk in comfortably, get the care that you need, and return comfortably. So in future, we plan to expand this to Mulago, Mbale, Soroti, and Gulu. These are also areas of high burden, according to the National Sickle Cell Survey. We also plan to ensure that you have the necessary equipment. The director put forth his request for an HB electrophoresis machine. Director, we pledge that we'll try all possibilities to ensure that you have it. In the meantime, let's continue with the screening program that does not cost a shilling. As soon as your baby is born, blood is taken off and results are given back to you. Allow me to appreciate the staff who have been doing this in a very special way. Thank you for your commitment. I also request that we take very good records of those who are accessing both the newborn screening as well as the treatment, because we need to follow them up and ensure that they get the best quality care. But it is also important for purposes of our planning because the very early newborns may not be on treatment, but we need to follow them up until we are able to put them on treatment. As I conclude, allow me to appreciate our partners, the American Hematology Association, Peking Elmer and Novartis, and Cincinnati Hospital for this far that we have come together, and all the support and your commitment to ensure that our sickle cell program runs with the quality that the patients deserve. Allow me also to appreciate our government for its commitment to give care to our patients and long life care. It is not easy to commit to long life care. It is expensive, but as many of you are aware, the NRM government is pro-people and works for the people. We will also endeavor to see that our health workers are supported to do the work that they need to do in a better environment that they so much deserve. Allow me to appreciate the city authorities for your commitment to ensure that this is transformed into a city. When I sat there, I saw people struggling between a district and a city. We are in the city. And I request all of us to treat the city with the clout that it deserves. We are not forgetting the hospital. The hospital is, the district is extremely important, and we are one people. Whatever services we provide in Lira City, we shall scale up in the entire Lango sub-region.
My name is Jafar. I'm 32 years of age, and I am a sickle cell disease person. I've lived with it for a very long time, since 8 months till now. I stay in Lira, and I'm a mother. I have a 7-year-old boy, but he's not positive with the disease.
What challenges are you facing?
The challenges I'm facing is about the treatment, is the transport, and at times we come, when you arrive, since the clinic is mixed up, sometimes you get the drugs late. So we're like urging the government to help us with that. At least the sickle cell department would get another clinic of its own.
What are some of the challenges you encounter here
in the hospital?
Yes.
And also in the community?
In the community, we are taken as like caste. We are called names. It's really hard for us to get jobs. Yeah. Like now, since I moved with a clutcher, it's been 3 years since I got a problem with my hips and it needed surgery. And this is costly. I've been trying to look around, but there's no one to come up, because they're like, after all, she's going to die. We don't need to help her. So it's a little bit hard for us to move on with life. When it's hot, it's worse. When it's cold, it's worse. So, but at the moment, we are really thankful for the drugs that we are given. We are controlled by the pain, and this at least helps us to live at the moment. Currently, we are not facing a lot of challenges as per now. The only issue is just the mix-up. Yeah, because we get, as sickle sellers, we have a tendency of getting tired so fast, dehydrated. So when you take long, like to sit without taking water, it really affects us. So when we are crowded in the same place and they call books and you have to follow the protocol. Because you want the drugs, you have to sit and wait. Yes, that is the challenge you only face, but you're really given your drugs.
And always timing.
Always timing, because every month, every patient has a date. Yeah, because every month you're given a date to come back for your review. It's up to you either to come for it or not, but the treatment is free unless there's a particular drug that you are supposed to use. Then you're written and you get in the outside pharmacy. And sometimes we get the challenge when we have some tests like the CBCs, typhoid, those difficult tests, you're told to go outside. But right now, since the minister said they are going to have a laboratory that is going to help us, at least I can be of help. Yes.
Did you say you're married?
No, I have a son.
Single mother?
Yes, I'm a single mother.
Where is your home?
I stay here in Lira.
Which side of
Urelo. Yes. My husband left. Yes. Because of the difficulties he was facing. We have been dating. We dated for so far like 2 years. And at first, when you're dating with someone and you keep a secret, the person will dig out and know what it is. So for me, I felt free to tell him what was going on. So when I told him I have the disease, he first kept quiet and didn't say a word. Because he knew, like, it transmits. Yes. But I told him it doesn't transmit. And besides, I was old enough by then. So I sat down with him and talked over it. Unknowingly, things happened. I got pregnant. So by 1 month, 2 months, I was fine. But when it reached 6 months, I got complications. So the gyno told us the baby is fine, but he's underweight. And we needed blood and several tests. But I think now he got tired of the situation. He had to leave. And he thought maybe I was going to die. Because we were given options of cesarean or either to save the baby or save the mother. But now he decided just to keep quiet and run away. But unfortunately, by the grace of God, I gave birth very well, and my son is grown up. He's very healthy. Yes.
And what is he saying now?
He's there. He sends help. Yes. But I think he's just still scared. Because he keeps on asking, how is the boy? How is the boy? That is just his question. Yes. But ever since I gave birth, I didn't fall sick until 2 years back, when I got a serious attack that made me start limping. And unfortunately, my ball and socket on the hip side got crushed, and the doctors said it needed a replacement. Yes. Son is 7 years. Treatment at the moment. Yes, because the surgery is a little bit expensive, and we tried to talk to people around, but everyone seems to say it's high, it's high. So I've decided to let go and live with the pain.
It can cost about how much?
It's around 18 million. Yes.
Have you maybe tried to raise some part of the money?
Actually, it is the family, my family, which was part of it. So I wouldn't know anything at the moment, because they told me when they're ready they will let me know. But it's now coming to a year now. no one has come up. I haven't had anything. I'm in pain, serious pain. Today I thank God at least the weather isn't so bad. I can come out. When it's cold, I cannot even come out. I'm always indoors, on socks, I have to cover myself because the bones eat up. Like something is moving in it. It breaks you. And you really feel the pain that you cannot even get out.
Are you working?
I was, but at the moment I'm not.
Where were you working?
I'm a salesperson. I was working with a company in Kampala. They gave me leave to come for my treatment, but since I came back, they tried calling me back for work, but I told them my situation has worsened. I can't go back for work.
First, let me your number.
My number? 789093109.
Honorable Minister, allow me to take ourselves back. When did we start this clinic? Since I joined this hospital in 2010, we noted that there was an increasing number of patients with sickle cell. Most of them were attended to in the OPD, general OPD, and then managed on the ward. As the number increased, there was need to follow them up in a clinic. So in 2013, we mobilized all the patients and their caretaker to come to the clinic, which is a pediatric clinic. We ran it every Friday. So allow me to state that since then, the parents came together, they formed an association, which I'm happy to introduce to you, the chairman of Sickle Cell Association, Lera. I think he came with the treasurer, Mr. Pius Okavo. Please stand for recognition. So they have been helping us to bring the children, the adults to the clinic, which we run every Friday. So that time we registered 1,250 patients, both children and adults, in 2013. So we continue managing them. They were coming all over this region, the Lao sub-region, as far as Amolata, as far as Apache. But we then went ahead to empower our health center 4, our general hospital, to open up and care for these children and adults in their different hospitals. So right now, as we speak, we have roughly about 800 patients attending to our clinic that comes once a month or any time that they are in a critical condition. So the clinic, despite the displacement from the current mental unit where we have been seeing them, we are not seeing them in a very small place, congested, but we still manage to see on average 40 to 50 children and adults every Friday, every week. They come to attend the clinic despite all the challenges that they go through, lack of drugs, lack of transport. They still come, and then we also want to thank them so much for accepting when we don't have drugs to buy those other essential drugs that they need to take routinely. Honorable Minister, we are requesting that sickle cell clinic still be maintained and supported so that these children, the adults, are grown up. We also have this group admitted on the ward.
One, we can only lobby. How lobbying would make you work? Binu direct to your accounts. Lego na tieni gamente nuong chiente te chulo lunch allowance. Yen lunch allowance me tuta de pe wilu chiem. Tuta rio pe wilu chiem. Mando tunishawa me launching newborn screening. Launching the newborn screening. Sorry, I'm speaking in Luo. So Mando want to launch yoko. You are me put cover. It is now my honor and pleasure to declare quality treatment for sickle cell anemia officially launched with hydroxyurea. And then for the newborn screening, blood spot removal kits ready. So anyone who is born has a full kit, even with the protective gear. So there is no need saying gloves are missing or the prick is missing. Everything is available. So I also declare the newborn screening officially launched for God and my country. I'm now moving to stand here. Now I've launched already. I want to talk about Corona. I don't need the table now. I want to talk about Corona. You take it back. Macho no kope tu sickle cell, mando lo kope tu Corona. Kwa yeye una kuojo ducha me uruku mask. Kaine uniruku mask bakchi. Kaine uniruku mask etu umiti aha. Umiti aha. Kenana hanena tiangi yoping, yoke no ruku mask very smart umiti aha. Kai we umumi aha, pei konyere kedi. Kien tuo Corona wori yamo. Ena wori yamo ni ka umiti aha. Iwa yukudi metuo Corona te wori kori. Tuo Corona ubiru doping. Yonge joy bolu kui dwe me achiero doping, dwe me rio doping, dwe me adete wot ping. Aya. Dwe me angwen. Yoteta moni tuo Corona pe. Ni Uganda do lol wenye tuo Corona ko duch. Yote bolu mask ko. Jo bolu kibo yu dog kele kibo yu rumu ko. Etu tini ni ami tumi yu ngeyo. Ituo Corona tia duo. Ena tia duo goni district sukenne kede kaperu kenne jo ame upimu kede tuo Corona tia meda. Achoki bolu wakan